Well, let's now cross over to Tom Casy, the MSF Sudan Communications Coordinator. He's based here in Nairobi in Kenya. Tom, thank you for joining us on the program. Just how bad is the humanitarian situation in Sudan as we speak?
Hi Beatrice, it is good to speak with you. The situation is dire. There's huge needs caused by the conflict, and healthcare workers and healthcare staff and organizations like us, MSF, are struggling to keep up with the needs. In Omdurman and Khartoum, the fighting continues. It's very intense. Gun battles, shelling, airstrikes, and people are being caught in the crossfire. MSF works in 5 hospitals in Khartoum on both sides of the front lines. And in just 3 of those hospitals in July, we treated 1,800 people for injuries caused by the conflict. That's 1,800 men, women, and sadly children too, with gunshot wounds, shrapnel injuries caused by explosions. So the conflict is having a direct impact on the population, but of course, it's not just people who are injured who face the consequences. The health system is struggling to meet the needs. Many hospitals are closed. Those hospitals that are still functioning can be in places where it's very dangerous. People may delay seeking healthcare, and sometimes, people delay and it's too late. And then, as your report mentioned, huge numbers of displaced people, millions, in fact. Services are completely overstretched for those people, bearing in mind Sudan already hosted a lot of people displaced from other conflicts in the region. So for displaced people, there's inadequate water, healthcare, sanitation, and we're concerned about the spread of diseases. There's malaria in the area. We're concerned about measles. So the situation is quite grim, to be honest with you.
So how exactly, I want to get a clearer picture here, how exactly are organizations like yourself, like MSF, how are they coping? What are international organizations like yours doing to help?
Well, for us as MSF, we work in 10 states in Sudan, providing a wide range of healthcare. I mentioned the war wounded, but also maternal healthcare, pediatrics, services for displaced people. But it's clear that we as MSF and all international organizations must be doing more, that the needs are huge and people need more support. But I think it's really important to remember that the bulk of the work being done to respond is being done by Sudanese people themselves, helping their own communities. MSF has 1,000 Sudanese colleagues working in Sudan. And actually, in the hospitals where we work alongside the Sudanese Ministry of Health, and even volunteers, people like medical students are giving up their time and dedicating themselves to try to respond to the needs. The circumstances are incredibly challenging. Many hospitals lack medicines, supplies, even basic utilities like electricity and water can be cut off at times. So people are trying their best, really working around the clock to meet the needs, but it's a really, really challenging situation.
So you're mentioning that the needs are huge and, that conflict shows no end of abiding. What do you think needs to be done to help with the situation?
I think everyone needs to do more, frankly. It's a challenging place to work in Sudan. It was before the conflict and it continues to be. But nevertheless, people's needs are so great that we simply must try to do more. We have faced challenges to do with bureaucratic restrictions or obstacles, obtaining sufficient visas. MSF has 80 international staff working in Sudan, but we need to be able to bring in more to scale up, but also to continue our activities. Teams are working flat out round the clock, providing healthcare, and people can get tired very easily. So the support of the authorities, being able to bring in new staff and supplies would help. But ultimately, one of the greatest challenges is simply the insecurity, the violence. Fighting and explosions, gunshots can be extremely close to the places where we work, making it hard for staff, suppliers, healthcare workers alike to reach hospitals. And we just call on the warring parties, to ensure that hospitals and healthcare workers don't get caught up in the fighting. If hospitals can't function, then everybody suffers.